Well, good afternoon, everyone. I'm Carol Shires with School Choice Wisconsin, and this is another one of our School Choice Wisconsin Action Quality Series. We are excited today to have our guests from the UnitedHealthcare providing us with information on mental health. But I also want to make sure that you have on your calendars later in the summer, we will be hosting another one focused on health, but that one will be on concussions. That'll be on August 3rd. So get that on your calendars. In the meantime, we'll have a couple other ones throughout the summer, but I did want to just get that on your radar. So with no further ado, we want to just jump into today's session. We are excited to have Dr. Nicole Brady with us today from UnitedHealthcare, and she has helped us before in the past, and we just really appreciate your being here and sharing your incredible expertise with us, Nikki. So I'm going to let you take it from here, and you can share your screen as you need to.
Great. Carol, if you could just confirm when you can see my screen, that would be great.
We can see your screen. Yes, there you go. Perfect.
Wonderful. So thank you all for allowing me to come today and kind of share where we are regarding mental health, in the world, and in particular in the state of Wisconsin right now. I did want to start out with a quick slide of introduction for those of you who don't know me or haven't ever gotten the chance to meet me. I am Nicole Brady. I am the UnitedHealthcare Chief Medical Officer for the employer business in both Wisconsin and Michigan. I am a family physician by training, and I do still see patients in a nursing home practice on a very limited part-time basis, but do still have my big toe in clinical care. I am married. I have two teenagers that you'll see in the left side picture, Gavin, our 15-year-old freshman, and Ariana, our 13-year-old seventh grader. Also have two dogs, two 1.5-year-old Rottweilers, a big boy on the left, Bolt, and a little girl, Kimber. I'm a Wisconsin native. I'm an avid sports fan. Right now, we are in the phase of life where we love watching our kids compete more than anything. You can probably see by the baseball hats, we're a baseball, softball family, though both of our kids play sports pretty much year round. When not playing sports, we love to be outside. We're always in the woods or on the lake. We travel a lot. My husband and I in particular love cooking and wine. And the top picture on the right is me and my husband just a few weeks ago in Piazza Navona in Rome, Italy. We were on a religious pilgrimage with the Franciscan Sisters of Christian Charity. I sit on one of their corporate boards, and they were going for a pilgrimage and invited us along. So we just got back from Assisi and Rome. So really excited to be here today. That's probably giving me a little renewed energy, and hopefully that comes across in our presentation today. So I just wanted to really point out that May is Mental Health Awareness Month. I bet you lots of you know that. And this is really important because even pre-COVID, and we're going to kind of go into the effect of the pandemic on our mental health, but even pre-COVID, 1 in 5 adults had a mental illness. 1 in 6 school-age kids had a mental illness. And a stat that always strikes me is that about 135 million people live in an actually designated mental health professional shortage area. That's 41% of our population. And when I said kind of actually, I mean that those mental health professional shortage areas are very minimum standard for the need for mental health professionals, not necessarily standards that really support true access to care. So more of us than even that 41% actually live in an area where it's hard to get a visit for mental health providers. But really, Mental Health Awareness Month serves as a reminder to all of us to really pay attention not only to our own well-being, but to the well-being of those around us, and really to take an active role in mental health care for ourselves, our families, and our communities. So mental health really shouldn't be looked at as in a silo. We don't have people that have mental health issues and other people that have physical health issues and other people who are affected by social determinants. These all come together in individual people. So they shouldn't be looked at separately. They should be looked at very interconnected. I have some stats up here. Again, about 20% of US adults live with a mental illness, 60% live with some type of chronic disease. But study after study has shown that actually 80% of your health is determined by social factors, not what you go see a doctor for. So really important that we understand that all of these really interact with each other like a big cogwheel. So we have to kind of quit looking at them as separate entities, but really look at them as whole beings. So let's talk about the global pandemic. I am hoping that everybody on the phone and on the call today knows that the global pandemic was around COVID and isn't quite over, though we're hoping we're going into an endemic stage, meaning that COVID is going to become just another illness that flares up every once in a while, like colds and flu. But technically, based on the numbers, we are still actually in the pandemic, though coming down. So I wanted to point out some of the negative effects of the pandemic. So you can see that depression has almost tripled in these, and some studies say perhaps quadrupled amongst our adults. At least 1 in 3 Americans in 2021 were diagnosed with depression. Women with children in particular, seniors and multiracial adults are the ones who are really hit the hardest. In addition to depression, about 41% of adults in the US in 2021 actually admitted to suffering some type of mental health illness. So could have been depression, but it could also have been anxiety, bipolar, or other underlying mental health issues. 41%, I mean, that's approaching half of our population. That means of all the people that you interact with during a day, almost half of them are suffering from some kind of mental health concern. For those of us in healthcare, parents, educators, also really important to note that 46% of our kiddos have showed new or worsening signs of mental health illness. Again, we're almost approaching half. I think that is just outstanding. A quarter of those kids say that they know somebody who has had suicidal thoughts. I mean, that's 1 in every 4 of our kids. So this is something we need to talk about, not something that we should, something that we have to talk about now. We have seen a dramatic increase in ER visits related to mental health. You guys may have seen in the news recently, Children's Hospital of Wisconsin, Milwaukee actually opened a separate department on their ER specifically for walk-in mental health emergencies or urgencies. So people in our state are doing something about it. In the most recent America's Health ranking, which collected data through the pandemic and into early 2021, we saw that Wisconsin now ranks as #1 in the nation for excessive drinking. And #1 is not the spot you want to hold. That means we across the nation as a state drink the most. We're #5 for alcohol use in youth. What we found out during the pandemic was that our alcohol and drug use changed, but didn't necessarily get better. For most of us, it got worse. By that, I mean, we did see the rates of binge drinking fall quite a bit, probably because we weren't able to go out. We couldn't go to parties, weddings, the bar, a concert. So we didn't have as much binge drinking, yet chronic daily drinking amongst both adults and adolescents went up. Marijuana use went up. One of the good things, vape use in our youth actually fell during the pandemic. Another stat or another fact that I've recently read that also just really kind of hit me hard as to how the pandemic really affected our communities is that those frontline healthcare workers, studies have shown they have suffered as much moral injury as our military personnel who are deployed to combat zones post 9/11. So those soldiers who went up against Al-Qaeda suffered the same degree of moral injury as our frontline healthcare workers during COVID did. And now, just for a little bit of definition, moral injury is really when our own personal values go contrary to something that we are asked or have done. So I think of it as, the commandment, thou shalt not kill. So think of being a military personnel and really believing that, and yet having to go into a combat zone and having to take somebody else's life. Think about being a healthcare worker and thinking that your job, your personal mission to going into healthcare is to helping people get better, to doing everything you can to help somebody else, and knowing that during the pandemic you could not. And because we weren't performing up to our best during the pandemic as a healthcare system or organization, people died. So when that moral injury occurs, that is the precursor to depression, post-traumatic stress disorder, generalized anxiety disorder, etc. So I think that really struck me hard at how difficult this pandemic has been on all of us. I don't want to be a Debbie Downer all day, so I did want to point out that there were some positive effects of the global pandemic. I think a lot of us parents felt just some own personal positive effects. I actually saw my teenagers like every single day, which doesn't always happen nowadays. We watched some great movies. Both of my kids now know how to play cribbage, and we still have cribbage night. So I think there was some positive that came out, even from a personal standpoint. But there are some more global positives that came out. Telehealth has really flourished. Telehealth was one of those things we all thought was a good idea. It was kind of slowly building some minor momentum when the pandemic first took off. But boy, once the pandemic hit, we saw virtual care just jump up. Pretty amazing. Now, as the pandemic has slowed down, we've seen a lot of people return to in-person care. So on the medical side, we see that telehealth is coming back down. It is not, it's kind of plateaued off, but it's not plateaued off at the previous lows. It's still at a much higher level. But what was really interesting is that in the behavioral health space, telehealth flourished and has stayed up there. It is not dropped at all. About 50% of psychiatry visits are still accounted for by telehealth. About 30% of substance use visits are still delivered via telehealth. And this is great because this is helping people in all communities access behavioral health. And we're going to get into stigma a little bit, but it helps to get around that stigma, that thought that I don't want to walk into a mental health clinic. I don't want to be seen going into a counselor's office. Helps remove that stigma and helps some people feel more comfortable seeking care. Couple of other positives in Wisconsin in particular, our teen suicide rate has fallen since the pandemic, and we have done a great job of recruiting mental health providers here to our state in Wisconsin. I'll give a little kudos to our two academic systems, UW Health and Medical College of Wisconsin. Both of them have done a lot to really bring in people interested in mental health into our state. So let's talk a bit about stigma, because I think this is really one of the underlying causes as to why people don't seek out for their mental health issues. And I'll be honest, the stats we just previously talked about, things are probably worse than they actually appear, because we know that half of adults and a third of kids don't seek out for their mental health issues. That's primarily driven by fear. Now, when I was putting together this presentation, I thought to myself, what is the actual definition of stigma? Like, I think I know, I feel what stigma is, but I don't really know how to define it. And so I pulled 3 definitions from some of the online dictionaries. And I want you, I'm not going to read them to you, but take a look at them. And what are the words that stand out to you? Because when I think of stigma, I see 3 words that jump off the page. I see disapproval, disgrace, and discredit or shame. And I think if I had an underlying mental health issue and I was afraid of disapproval, disgrace, or shame, I probably wouldn't go seek help either. And so this is why we need to start talking about mental health issues. We need to start normalizing them. We need to start showing people we're not going to discredit them, disapprove them, shame them, disgrace them because they come forward concerned about their own mental health issues. Studies have shown that 1 in 3 workers actually fear retaliation or job loss if they would discuss their mental health issues. So think about those telehealth visits for those people who think, I can't tell my boss that I have to leave for an hour every 2 weeks to see a therapist. Now they can do it after hours from the comfort of their own home. I had one patient who actually used to take his therapy appointments from his car in the parking lot. Kids who are known to have mental health issues say that they experience negative treatment by their peers about 60% of the time. 35% of those experience negative treatment from school staff. Now, again, try not to be a Debbie Downer. On the flip side, 22% of kids who came out about their mental health issues actually felt more supported by school staff. And I think what we just need to do is really continue to grow and promote that type of behavior from our schools so that kids feel more and more comfortable coming out about their mental health symptoms and concerns. Here's some of the harmful effects of mental health stigma. I think it's a no-brainer that if you are concerned, you're afraid that you're going to be stigmatized, that you're probably not going to seek help, which can lead to worsening symptoms, poor compliance with treatment. All of that can lead you to isolating yourself. But even more concerning is that this becomes a vicious circle. So now you have troubles performing at school or at work. Now you can't find stable work or housing. You become socially isolated. And that only brings you right back up to having worsening symptoms and poor compliance with treatment. So again, really important that as communities and as societies, that we really work to combat mental health stigma. So I wanted to talk about some signs of mental health, and I have a whole lot of symptoms up here on the screen, but I'm going to tell you it varies from person to person and from kid to kid. Everybody is so different. So I think it's really important for us to be cognizant on a regular basis of how we feel and how our kids, family, friends, students, coworkers are feeling and looking. I think we get so busy in life that we forget to really take a scan of ourselves and on the people around us. Because what's really important when you're looking for signs of mental illness is changes from baseline that persist. So I think about that kiddo who walks into class one day and they just kind of look sad and down and blue. You might not really think a whole lot of it. They're a little sad and down and blue. We all have our days. But now 1 week later, 2 weeks later, that kid still looks sad and down and blue. Now that kid is just kind of short. You try to help him with work and he's just not really as receptive. Maybe gets a little snippy with you. Nothing big, but just not as usual. Next week, you realize he's not even talking to his friends anymore. Those are significant signs of mental illness. Those are significant reasons to have a conversation with that kid. When you're talking about yourself, again, really think about, are you feeling sad or down, helpless or hopeless? I want to point out that the actual diagnostic criteria for depression is not even necessarily that you have to feel depressed. One of the other key components is that you have a loss of interest in things that you used to be interested in, things that you enjoy. You can definitely have physical symptoms, recurrent stomach aches, chest pain, headaches. I say any kind of recurrent pain is kind of a flag that there might be something going on regarding your mental health. Trouble sleeping, changes in eating or sleep habits. And again, all of this as it goes on can affect academic and work performance. Let's not forget that mental health also includes substance and alcohol use disorders. So looking especially in family members who we see a lot, do we feel like they're using alcohol or have signs of other drug use? And again, any type of extreme mood changes, highs, lows, anything in between. But back to my original statement, what you're really looking for is those things that are a change from somebody's normal. So it really helps to get to know the people around you so you know what their normal is, how they typically interact with people and with the world around them. So when and how to seek and offer help is really important. Now we talked about signs and symptoms that are ongoing and when it's really important to step in, when you've hit the point where you can no longer avoid it, and is when it's starting to affect somebody's ability to function. So the kiddo whose grades are starting to fall or is no longer wanting to participate in sports or extracurriculars that they love. When your family member no longer wants to socialize with friends or family, no longer wants to have holiday celebrations, when work performance is affected, that's when somebody has to step in and you have to seek help. I did put on there when self-help strategies have failed, and we'll talk a bit about those a little later in the presentation. But again, it is okay to recognize that you're feeling down, you're feeling blue, you're getting irritable. I know I did during the pandemic. And it's okay to first start and say, what can I do to make myself feel better? So during the pandemic, I started getting really irritable. I didn't really want to talk to people. I was crabby. My kids complained. And I realized that what I was doing was getting up in the morning, walking out to the kitchen and making my coffee, sitting down and reading for a little bit. And then slowly I worked my way into my office to work. Yes, still in my pajamas. Yes, ladies, with no bra on. And a lot of days I hadn't even brushed my teeth yet. So I really totally lost my schedule. So I started feeling crabby. I just said, listen, I got to get back on a schedule. So even though I was working from home, I got up every morning, I did my usual exercise, I brushed my teeth, I combed my hair, put on some makeup, even though I wasn't leaving the house, changed clothes, even though my husband would tease me because I was putting on one pair of yoga pants one day for work, and the next week, those might've been my pajamas. But either way, I got myself into a schedule. And for me, that helped a lot. But there's a lot of self-help things that you can do to improve your mood before it gets to that point where you really need to seek help from others. And you're going to hear me say this over and over again. The first step to intervening with yourself or with somebody else is to talk about it. The first thing you should do if you're struggling is go to somebody you trust and just plain talk about it. Share your feelings. Validation goes a long way to making you feel better. Hearing that other people are having similar issues goes a long way to helping you feel better and also giving you that motivation to take that first step to make a change. If things aren't improving, or if you just don't know who you would talk to, you can always go to your primary care clinician. They are always your first line of contact. We are well trained to treat the vast majority of mental health issues. Most people can be treated by their primary care clinician and actually never even have to go see a specialist or a psychiatrist. So always go to your primary care clinician first. Still not sure, maybe you don't have a primary care clinician that you see regularly. By all means, call the number on the back of your insurance card or log on to your insurance's website or portal. Look for a primary care clinician. But what's really nice is most customer service representatives, regardless of your insurance company, are well trained to help you find the right provider, the right location at the right time. They can share what your plan covers and they can find you somebody in your network. The vast majority of employers, if you are employed, have an EAP program, and some of them even will cover dependents. So talk to your spouse if you're not employed, talk to your employer, look through your employee benefits manual, but EAP is a great way to start. Typically, you have several free sessions that come with EAP, and not only can they help you, but if they feel like you need ongoing treatment, they can guide you into the right treatment. And then look into virtual options. They are convenient. They can usually get you an appointment within 24 to 48 hours. Almost all plans have them covered nowadays. Almost all provider groups, especially behavioral health provider groups, offer virtual visits. So consider looking at that option as well. It would be remiss if I didn't point out that anytime there's evidence of any thoughts or form of self-harm, suicide thoughts or action, that is not a time to ignore it. You have to step in. You have to help people get help. For these types of severe symptoms of self-harm, call a 24/7 crisis line. If you think somebody's actively suicidal, call 911 or get them into an emergency department and seek emergent care. But very important not to ignore those really severe and acute signs. So let's talk a little bit, spend some time on, so we talked about how to recognize and when to intervene, but boy, now what do you do? So you're gonna hear me over and over again say, you gotta talk about it. We have to start talking about mental health. We have to start sharing our own experiences. We have to break that stigma and help people feel comfortable coming forward and seeking treatment for their mental health. As parents, we can spend time together as a family, get outdoors. We can help kids foster a regular sleep and wake schedule. promoting physical activity, eating healthy diets. But again, though I put it up towards the bottom, open dialogue. We have to talk about it. And it's not just waiting for our kids to come to us and then being open to the conversation. It's about asking our kids how they're doing on a regular basis. It's about asking our staff, about asking our coworkers, about asking our spouses and our other family members, how are you doing? Remember, I said earlier, we got to check into those around us. Don't just go through your day so busy and just make some, rudimentary highs and hellos and how you doing along the way, but really stop and listen and see how the people around us are doing. Give them the chance to answer and share with us. And, I think it's really interesting that there's been a lot of studies that show that this kind of interaction, this just asking, are you okay? How are you doing? Can happen alone, one-on-one, but can happen in a family or a class setting. I don't know how many of you have looked at the Voices of Wisconsin study, but this was done by the Wisconsin Institute for Public Policy and Service. It was done kind of in the early 2021 area. They did it for middle school and high school students. What they did is just got some focus groups together and did a qualitative analysis or research, did focus groups of these kids groups and said, how did the pandemic affect you? How did it affect your mental health? How did it affect substance use in your schools? What's your perception of what schools did good and did bad when it comes to virtual learning? Or like, how did that affect you? And I think what really hit me is their last question for both the middle schoolers and the high schoolers is, what did you think of this focus group? And both groups said just being invited to this focus group was amazing. Both of them said it made their mental health better just by having this focus group and by being able to share with like peers what the experience during COVID was. So again, especially when it comes to schools, this doesn't have to be individual one-on-one counseling with each kid. It doesn't even necessarily have to be, screening questionnaires, though that's definitely a way to do it, but can also be group sessions. It can also be teachers just checking in the beginning of class. Many kids during these focus groups said the teachers they appreciated most during the pandemic were those that just simply started class with, how are you all doing? And allowed the kids just to talk and say how they were doing. They said the teachers who are all about, we're not going to talk about it unless it's related to math, were the ones that they felt were the least supportive. So really think about how can you create a culture of that supportive staff? How can you create a culture where kids and staff alike feel supported regardless of what their concerns are? Going even a little deeper is really kind of teaching kids how to recognize emotions and then teaching them what they can do about it. So often kids just feel alone. They don't know that other kids have these symptoms. They've never navigated the healthcare system themselves. They have no idea what step one would be. All they know is they feel crappy. So helping them to learn resources, helping them even to verbalize, you want to come see the student counselor, what do you do? Who do you ask? What do you say? Can be really helpful for kids. I think lots of schools nowadays are definitely considering school-based mental health services. I do think that gets a little bit harder as your district gets smaller, but definitely there are community resources out there. A lot of not-for-profit mental health providers are willing to help support schools for no other reason than say to sit on a committee. So really think about who are your community partners and how can you draw them in. And let's not forget to partner and support our parents. A lot of parents don't have a lot of experience with mental and behavioral health, or if they do, or unfortunately suffer from it themselves, they might not have really the skills to help their kids navigate that as well. So again, biggest one here though is still to talk about it and start the conversation, and then making sure that conversation is ongoing, not just in the month of May when it's Mental Health Awareness Month. What can leaders and employers do? And I love the first bullet point here because it relates to my pretty star about just talk about it. And that's be vulnerable. As a leader, as an employer, share your own struggles. whether it's personal, like I started getting some depression at the beginning of COVID and had to change my schedule around. Whether it's related to, family members or friends that you think is reasonable to share your experiences and training, but really share that you understand and can sympathize with what people are going to. Just sharing that opens the conversations for others and makes you a leader that people feel that they can trust. If you are willing to share your feelings with others, then they're more likely to share those feelings with you. Modeling healthy behavior. I think all of us who've gone through leadership training have heard this one. Don't tell people not to email you at 3 o'clock in the morning. Don't tell people to have a good work-life balance. Really model that behavior. Have those expectations for yourself as well. We shouldn't be leading with a practice what I preach type of mentality, but really showing other people the importance of self-care and wellness. Again, watch out for stigma, look for signs of stigma. Not all stigma is purposeful. Some of it is just misunderstanding. So help educate, help break the stigma, and again, help create that support from the top down. Love it when employers can integrate wellness into the workplace, when they can really determine what's going to help people feel better, making sure employees have adequate break time, making sure they have access to healthy food, making sure that they have access to opportunities for physical activity, teamwork and team building, whether that's, a lunchtime walking group or having an occasional, coffee clutch early in the morning. That's really just to talk and less about work. All of that can really help build a culture of connectivity, which makes people feel more willing to share their concerns. And then obviously, as employers, you can offer benefits that matter, communicate them out. So making sure that behavioral health benefits support the population you serve. And then by communicate that out, I mean, not just on January 1 at renewal time. I mean, really getting in front of employees and reminding them throughout the year what great benefits they have. Because I can tell you, if you start having a problem in September, the last you heard about your mental health or even medical benefits was in January, you have no idea what you're doing in September. So whether it's recurrent little emails from the HR department, whether it's a communication from your health plan, something to have that continuous reminder of what benefits support your employees' health. I did want to share what UnitedHealthcare is doing, and I do think that it's very similar to payers across the nation. Payers are just as focused on mental health right now as employers and our provider systems are. UnitedHealthcare is a payer. We are really trying to guide people to the right care at the right time. So building our online tools and our apps to make it really easy for people to access care. And we are definitely offering a broad range of behavioral health solutions, whether it's telehealth visits, provider visits, and we're going to talk a little bit about some of the digital health tools as well. Before I do that, I mentioned that in Wisconsin, we had an increase in the number of mental health providers. And fortunately, we were able to contract with the vast majority of them. And so we grew our behavioral health contract, network, not just in Wisconsin, but across the nation quite dramatically through the pandemic. We now have one of the nation's largest mental health networks. But I want to back up and I want to talk a little bit about these digital self-help tools, because these are just so cool. I mean, even as a practicing physician, I just love these tools. So I'm going to start with Able2, and then we're going to move back to Sambella. But Able2 is virtual coaching and therapy. So remember I talked about how I had the patient who used to go out to his truck and do his behavioral health visits in the parking lot. What he was doing is he was going out during his lunch break and seeing his therapist, and he did it via a app similar to Able2. But imagine having access to your therapist on your phone, on your iPad, easily accessible. I think I always say phone, because who isn't carrying their phone in their back pockets like at all times? So really nice to have access to that. Makes it really easy to fit in your therapy session, even if you have to run and pick up kids or get home from work or get the dog from doggy daycare. You always have the ability to do it on the go. So Able To has really just been great. They're one of the first ones that came out with digital therapy and coaching. So it's really a wonderful tool. Sanvello is a self-help app that is now on steroids. And I'm going to advance my screen because I have a kind of a little picture that shows it. So you download it on your phone and log in. And everybody who has any type of UnitedHealthcare coverage has access to the robust or the Sanvello on app, but almost anybody in the United States has access to the free Sanvello. And by free Sanvello, what I mean is that there are self-help tools. So mindfulness, journaling, educational sessions to help people find out how they can help better improve their own mood. So I played around with this. I told you already, I divulged that I got some depression early on in the pandemic. Mild, was able to treat it myself, but I went on Sanvello and thought, oh, what should you do to treat depression? And, you know, like I said, one of them was develop a regular schedule, get into routine, which was the first thing I did. One of the other things it said was exercise, but not just exercise, but get outside. So I did some research, and it turns out that the outdoors in and of themselves, no matter where you live, in Alaska where it's dark half the year, or down in the sunny Caribbean, just being outdoors has been shown to increase mood. The more minutes somebody spends outdoors, the better their mood is. So I started not just getting my schedule better, but instead of always walking into our back little living room, just kind of a little dark, and hopping on the elliptical, I actually started going outside and trying to get exercise outside. I started taking the dogs, even if it was just a 2-minute walk through the woods by our house. I took them on a quick little walk just to get outside and force myself to do it. Did not always want to go outside. I told you I was Wisconsin native. I don't want to go outside in the winter. It's cold, but had to find a way to get outside and get more active. And that's what Sanvello does. It has a lot of mindfulness resources. Mindfulness has now been shown kind of over and over again to be very helpful for stress and anxiety. Can also help boost mood with depression. So again, a lot of mindfulness activities on that app. Now, you can pay for independently, kind of the Sanvello on steroids. Like I said, a lot of UnitedHealthcare and other payer members do have access to the on steroids part. And in that way, you actually have access to therapy appointments, and you actually can get into psychiatry appointments if it's available for you through your plan. So really just a fun tool, but I suggest everyone download it and just try the free version, if nothing else. It's really good. And Sanvello actually sends you a text once a day that says, how are you doing? And then you like rate how your mood is. And then it'll come back with something very quick, like, you're feeling great today. Good. What did you do to make yourself feel? Think about how you made yourself feel that way. If you say you're not feeling well, it might come back with, I see you, you said you liked exercise. Why don't you get out for a 2-minute walk today? So it's really easy things to bite off and chew. I did want to put in some more resources. So we talked a lot, and I know I've whizzed through this really fast, but we talked a lot about just kind of what you can do as a person, as an employer, as a teacher, as a parent. What can we do to help those around us? But I wanted to give you some real specifics. We know that suicide is an awful thing for anybody to live through as a friend, family member, coworker. So I wanted to make sure that you had the National Suicide Prevention Lifeline right in front of you. And also, all this resource is now text capable. So you can see, all you have to do is text hello to that number, and you'll get a response immediately. You'll see that it is the same text number for the crisis text line. So that makes it really easy. There's another number for our Substance Abuse and Mental Health Services Administration National Hotline, again, specifically for those struggling from alcohol or other types of drug abuse. And I put these up there because I think we all kind of think that those are really good for somebody else, but I can tell you these numbers are very, very helpful. You can call that National Suicide Prevention Lifeline. It doesn't have to be even that you're sitting with somebody who's suicidal. You can just call and say, you know, I'm a little worried that this person I work with might be getting close to like feeling suicidal. Like, what can I do to help? And these people know where you are. Most of them, you're routed usually to a number that's local to your state. And they are really good about helping educate you on what to do and where to go for help. The thing that I think I'm most proud of as a state is the bottom one, the Wisconsin Behavioral Health Line, or 211. Many of you guys may have heard of 211 in the past. It is a number that is nationwide through the United Way. It has really beefed up their behavioral health resources. And in Wisconsin in particular, we have now deployed 8 locations for these services across the state. So when you call 211, you will likely get somebody who's actually located relatively close to you. They have all the resources you could imagine for behavioral health. They will get you to people who can help you. They will get you to the correct people. And you can see on the bottom, though 211 to me is a really easy phone number to remember. You can dial them, you can text them, you can get online to their website, which I have up here. You can chat with them, or you can just search for resources. But it is just wonderful. So I always say, if you are confronted with a situation and you just don't know what to do next, maybe somebody confides in you for something that you think you should probably tell somebody about, but you're not really sure you can or should, call 211. They'll help you through it. They're really, really wonderful. So I did want to thank everybody for listening to me today, but more importantly, I did want to give a little bit of time for questions. I give a really high level overview and buzz through some information really, really quickly. So I'm hoping that maybe spurred some thought and you may have some questions for me. You'll see that many of these quotes up here are really about talking about mental health, not being afraid or fearing the stigma, and doing your own part to help break down that stigma and encourage others to seek help and to talk to us. So I would love to open it up for questions. Carol, not sure how you wanted to do that. If you want people to put them in the chat or just come off mute, I'll leave that to you.
They are welcome to do it either way. Dr. Brady, thank you so much. We did have a number of questions that came in prior to today's seminar. And one of them, I'm just going to pitch out there to you that I thought was particularly good was the person asks, how do we help students with anxiety whose parents excuse them from school on a frequent basis, and you see their grades continuing to drop? What kind of a suggestion do you have?
You know, that's a really tough one. And I say that because think of being a parent at home and having a kid who's really, really anxious and wakes up every morning crying and clutching their belly and saying it hurts so bad and they can't go to school and they look like they can hardly walk. And even as a parent, even if you know that this is underlying anxiety, when your child is sitting there crying about how much their belly hurts, like it's really hard to say, well, you just need to go to school today. Now, some of us like me are mean parents and probably would shove them on the bus anyway, but that's really tough. So I always first start with be sympathetic, understand that most of these parents are probably not just trying to enable their child. In all honesty, by not getting that kid to school, we are enabling them. We are actually kind of teaching them that, yeah, school is anxiety provoking and it's worth avoiding sometimes. So that's not what we want to, the example we want to set for kids, but it's sometimes hard for parents who don't know that. And so I would say first and foremost, as a school, whether it's a teacher, the school counselor, or even somebody a little higher in leadership, first is to really try to work with those parents. How can we help you? This is what we know about school anxiety, and we know that missing school doesn't help the anxiety, and it can make it worse and cause it to be more protracted. But let's talk about how we can work together to get that kiddo back in school. Make a plan. What kind of accommodations can you make as a school? You know, can you get them in the door, but maybe have them spend some time with the guidance counselor at the beginning of the day before they go into the classroom? Like, what kind of accommodations can you make? What are the parents willing to do? Obviously, if it's to the point where kids are missing school, they need to have a healthcare provider involved. I said earlier, family physician or pediatrician, primary care doc, that's the first place to start. Ask them about what they've done, how that experience has been. Do they need recommendations for somebody else? Not everybody connects well with every doc or therapist. So I would say, first, start with the parents. We really need to work with those parents and see if we can give them the support and the resources that they need.
So kind of as a follow-up maybe to that, and another question would be, what's the best way to talk to a child that's coming to you with mental health issues? So if I heard you correctly, maybe it's just to talk with the parent, or what's the first step for these staff at school?
I would say if a kid is willing to talk to you and they come to you, for some reason, they trust you. They didn't come to another teacher. We don't, at this point, you don't even know if they've talked to to their parents, or if their parents know, right? But for some reason, they trust you. So first, be open and accepting, not judgmental. I think, and I'm guilty of it as a mom, my first, comment is usually, it's not a big deal, honey. It's not a big deal. But really, before you pass judgment or say anything, just listen. What are you feeling? How can I help you? What are your concerns? Ask those open-ended questions, especially for those kids who are in upper grade school, middle school. What do you think the best next step is? And then share, not what I'm going to do, but hey, this is what I think we need to do next. Sounds like we need to talk to your parents. Do you feel comfortable doing that? Do you need help doing that? Can we help you? So again, open-ended questions, being accepting, not passing judgment, not minimizing their symptoms, but really validating what they're feeling. And understand that as long as there's no evidence of self-harm or suicidal thoughts, that this conversation can take a little time to have. It's okay not to have an action plan the first time they walk up to you on their way out to recess and you have, exactly 62 seconds to talk to them. It can come over time. Understand that if you don't feel comfortable with those conversations, again, just listen, promise to follow up with them, and then seek help from somebody who likely has the skills to have those conversations, the school guidance counselor, the school psychologist, or some type of community resource. But it is more than acceptable to talk to those kids first, because you don't know if they've shared with the parents or if they're comfortable sharing how they feel with the parents. So be that first trusted parent or first trusted adult.
Excellent. What about out there with our listeners? Are there others that have questions specifically for Dr. Brady? This is a great time. You can put those in the chat, or you can just unmute yourself and share whatever your question is. I know one of the other questions that came in has to do more with staff. And obviously the last 2 years have been exceedingly stressful for all the staff and faculty at schools, not just the children. It's been such a difficult time for them, and schools are trying to figure out how to best step in and be supportive. You've given some tools that are interesting online. You mentioned employee benefits and checking what you have available. Any other thoughts in terms of helping those staff survive?
Yeah, I think really just being purposeful about checking in with how our staff are feeling. And I don't necessarily mean just the leader, like just the principal in the building, but I mean as coworkers, on your team, how are other people feeling? And so being purposeful, and by that I mean, don't just again walk in and as you breeze past them and say, hey, how you doing? But stopping in, in the morning before the kids come and say, hey, how you doing? It's been a rough couple of years, huh? And then just having that open-ended conversation with them. Starting off staff meetings with, we just want to take a minute to share how people are doing. I'd like to say again, the pandemic is feeling a little bit better in that a lot of our mandates are gone. We're back to lots of face-to-face activity. This is a great time to check in and say, how are you all feeling? Is that all helping? Is being back in school full-time, is that good or is it bad? Are there things you miss about teaching virtually? Just having that conversation helps to validate people, but again, helps to open the door as this is a safe topic to have in school. It's a safe topic to have in our building. And a lot of times through those conversations as leaders, we start to learn and get ideas of something that may be really beneficial for our teachers. Our school found out that actually our teachers missed having some virtual days. They liked the virtual days, so they actually switched mid-year for our older kids and put one virtual day in a month. And the teachers love it. I'm sure my kids love not having to go to school one day a month, though they still have to study and do their work. They like not having to get up early to get on the bus. So again, and that just came out of some staff meetings where across the buildings, all of a sudden, the principals came together and it turned out everybody kind of missed having a virtual day now and then. So that's where you can get some of the ideas of what do your staff in particular need to feel more supportive. Who knows, maybe it'll just be pizza at lunch once in a while.
That's great. I know one of the struggles, particularly for many of the private schools that might be on this call, is just the lacking the resources to be able to have those counselors available at the school. They don't have that staffing for mental health covered. Any particulars there in terms of looking for that support? You mentioned in brief early on about nonprofits and so forth that are out there that might be able to be helpful. Any more specifics on that?
I would say that as a state, the DPI does have a lot of great information on mental health in our schools and resources, a lot of education. But I do think for the smaller school systems where you don't have somebody on site, what I would recommend first is looking in your surrounding area for your mental health support systems in your community, both your physicians, health systems provider offices, what's available, as well as other community resources. And I get back to 211. The United Way knows all of the resources in our communities for everything. So that's also a great resource to find out how you can partner closely. But I'll tell you, most of our provider groups and health systems are more than willing to come on out and partner with schools and help to see how they can support them better, whether it's a consultative service. So, hey, here's a number you can just call if you have a question on a specific kiddo, to formal agreements for support.
Excellent.
It's really about bringing our whole communities together, right?
Yep. Well, Dr. Brady, I don't see any other questions coming in, but I so appreciate your time and your expertise sharing with us. I think also we wanted to touch base just quickly with our schools about the opportunity that they can invest in their benefits. So I believe we have Chris Urban on the line to share with us just briefly.
Yes, I'm here, Carol. Hello.
Hi, welcome.
Thanks for giving me a few minutes. So I just wanted to first say thanks to Dr. Brady. I thought the time spent on solutions was excellent. It feels like 3/4 of this was spent on solutions, which I think is really important for everyone. And my takeaway certainly was talking about it. I've got two high schoolers at home, and thankfully They still want to talk to dad a little bit, but I think it made me be a little bit more thoughtful with some of the questions that I'm asking to make sure that we're talking about it. Such a relevant topic. So anyways, I'm Chris Urban. I'm from Infinity Benefit Solutions, and we're a full service employee benefit broker here in southeastern Wisconsin, and we have been working in partnership with UnitedHealthcare and School Choice Wisconsin Action to promote a health insurance consortium plan for member schools. And I wanted to just spend a minute or two to talk to you with about that today. So what the program is member schools with religious affiliation can participate in a new program for their health, dental, and vision benefits through UnitedHealthcare. And specifically, I say new, but we actually rolled it out in March of 2020. And I think all of you know what happened in March of 2020. So we're gonna do a reboot, and certainly this opportunity to speak to you is great. And we'll have another opportunity through our partnership with UnitedHealthcare later in the year on concussions. But what really is this, and what makes it different than what you have currently? Just a couple comments on that. So really, member schools can pool their purchasing power for better rates. So as it stands, each school is kind of their own school, and they work on their health benefits individually. And this program would really allow the schools to move into a larger purchasing power entity to potentially get better rates. It also would allow them to get plan types that are only available to large employers. And the last thing is it would allow schools to take advantage of really a comprehensive network of doctors. So we heard Dr. Brady tout some amazing things that UnitedHealthcare is doing around this this topic. And I will also say that the network of doctors that UnitedHealthcare has is really world class. So another opportunity for schools to kind of tap into that as well. Question we get a lot is, can we use school choice funds? And the answer is yes, absolutely. Funds can be used for premiums for insurance. And how can we get more information? So many of you probably have brokers, and your brokers are well versed on the program. So if that's something that you're interested in, mention it to your administration and your broker to have them review the program with you. And if you don't have a broker, it's something that we can help out as well. So just wanted to say thanks again for everyone to participate in the call today. And I appreciate the time, Carol, and I'll flip it back to you.
Awesome. Thanks, Chris. Yeah, we're excited about the Health Insurance Consortium that School Choice has partnered with UnitedHealthcare on. And so if you have any interest in this and enhancing your benefits to your staff, check it out. Reach out to your broker. So thank you again, Dr. Brady, so much. Appreciate your time. Please remember, those of you, to join us in August 3rd for the next one on health. We'll be talking about the topic of concussions just in time for the fall sports season to roll out. So Dr. Brady, thanks again very much. And thank you to everyone who joined us today. Good afternoon.
Thanks for having me.